Hello, this is Bella and Maria, and today we are talking about the dental implications of a patient with rheumatoid arthritis. So, rheumatoid arthritis is an autoimmune disease where your body attacks the cells of the cartilage in your joints, which can cause a lot of pain and joint arthritis.
So, the common oral findings that you will most likely see in a patient with rheumatoid arthritis include xerostomia, which is dry mouth, and that can lead to caries. TMJ pain is also very common because of the joint there, have a hard time opening and closing. Gingivitis and periodontitis, caries, and oral infections.
So, for patient management, with a patient with rheumatoid arthritis is the medications they take. Patients with rheumatoid arthritis take a variety of medications, usually immunosuppressants because of it's an autoimmune disease, and analgesics for the pain. Immunosuppressants can cause xerostomia, which increases the body's susceptibility to infections like oral candidiasis, as well as it decreases the body's ability to protect against caries and decay. We also have to be sure we know the medication side effects because as dental hygienists, we will be administering medications such as local anesthesias. So we have to know the interactions of the medications they're on. Some treatment uh, adjustments that we need to make is the TMJ pain that they have. It can make it difficult for them to open their mouth for extended periods of time. So we want to keep the appointment short for these patients so they can rest their jaw, also providing times in between treatments so they can rest. Um, and then also providing pillows or other kinds of cushions to help them in the chair because their other joints can be in pain as well. So overall, just making these appointments short and comfortable for the patient.
So, going over patient education for the patient with rheumatoid arthritis, we want to make sure that they know how xerostomia can impact their overall oral health, and talk about the process of caries and how that can lead to caries. And we want to talk about gingivitis and periodontitis and how to maintain their gum health, as well as caries because of that xerostomia, they're at an increased risk. And then oftentimes there will be decreased dexterity or impaired brushing ability because of the pain in their joints. And so we want to find something that works for their grip on the toothbrush handle. We want to make sure that they're using a rinse for their dry mouth, such as biotin. We want to make sure that they're using the proper circular technique when brushing for biofilm removal. And we want to make sure they know how their autoimmune disease contributes to inflammation in the gums. Um, and we also want to make sure that they're using a flossing aid that makes it easier for them to hold the floss because oftentimes it's hard for patients with rheumatoid arthritis to properly hold the floss. And these are all the considerations for a patient with rheumatoid arthritis. And thank you for listening.